Her vision is for a future where mental health care becomes part of every school, workplace, and barangay in the Philippines. As part of this year's Forbes 30 Under 30 Asia Social Impact list, she, as a software engineer, is building systems and technologies that are making good mental health care accessible here in the Philippines. Please welcome on Thought Leaders, the founder of Empath, Steph Naval. Good to see you, Steph. Welcome to the program and congratulations.
Thank you so much. Thank you for having me here.
I was just looking at the website, very interesting banner. The opening banner was a call to action to journey to better well-being with us. What exactly does that mean?
So for Empath, we are a mental health company. So for us, our mission and our vision is to be able to help Filipinos to improve their well-being. At the same time, it's a journey. You understand it's a journey. And we'd love to be your partner throughout that journey.
But it's a tech-enabled health company.
Yes.
How does that change things, given that you're a software engineer, so you come from the tech space?
Yeah, so for us, we have a platform. So Empath, so it's a consolidated platform. So there, it's easy to book consultation. So in less than 2 minutes, you can already book through instead of, let's say, the usual traditional way of having to message, having to email back and forth the clinic. So it's seamlessly there. At the same time, the way we go about it is we partner with companies, schools, and even nonprofit organizations. So what happens is the company would cover the mental health benefits, the mental health consultations, even assessments. We've had clients that would even extend it to family members of employees. So not only do they get to easily access it, they get it for free. So that's how we are able to create that platform and system here in Empath.
And this platform's been in operation
For
since
around
2020.
Yes, so Empath.
That's exactly the pandemic.
Yes.
So Empath got started in the pandemic.
Yes. Empath started because of a personal passion project of mine. So when I was 14 years old, I was diagnosed and struggled with mental health conditions. And back then, it was taboo, very difficult to find support. Even from my family, when they would ask, who would you recommend? How would you find the right fit? Even as a young teenager then, it was very difficult. And through that lived experience, even after I graduated college and everything, it was still a pressing problem. So I started Empath first with consolidating on a booking platform of mental health professionals. I partnered with a school who is still our client for the past around 5 to 6 years already. So to make it more accessible for students to get free consultations. So that's how it started out. Social enterprise, we also got funded by Department of Science and Technology, developed the platform even more. And here we are today, serving over 40,000 Filipinos.
40,000 Filipinos across schools.
Yes, schools, the companies that we partner with.
Nonprofits.
Yes.
But what was that journey like? Because you started during the pandemic, and that was the time there was a realization that mental health was so important with people getting locked down and locked in. How has that evolved since?
Yes.
As we're now experiencing a great crisis of another kind, an oil shock that's entered its 100th day. Putting people at risk because of finances and also uncertainty over jobs, maybe in the future.
Yes, definitely the pandemic really pushed the conversation about mental health. I remember there was a CEO before who talked to me, quite seasoned generation. He mentioned we were in an dinner or an event, work event. He mentioned, Steph, before, I didn't believe in mental health. I didn't know what it was until the pandemic happened. And that's when I experienced anxiety attacks, concerns about uncertainty for the employees. So it definitely pushed the conversation across different generations. And I think all the more when you had, for Gen Z, my generation, your formative years or your college years, some of them high school years at home. It really impacts your development from social skills to how you handle certain scenarios in life. And definitely it pushed the conversation forward. Um, but it had very detrimental impacts, and that's what we're still experiencing today. So from Gen Z already entering the workforce, I think around even the crisis with the multiple scenarios and events that have been happening over the past couple of years in the Philippines, we actually have around, I think, the highest burnout rate from other Southeast Asian country. So around 70% Filipinos have been reported to feel burnout. Um, and at the same time, around 12.5 million Filipinos have been reported or shared that they have anxiety or depression or a mental health condition, which is something that definitely needs to be addressed and is also a very big problem right now.
How come? Why do you think that is?
Well,
We're atop the
mhm.
list of that list of mental health conditions and also burnout.
Yeah, well, one, it's very stressful to live in the Philippines.
Because
Even, I think, one, even just quality of life. So, for example, even commuting or traffic. The same time, sometimes even work culture. Um, in terms of I just also had a talk about psychological safety, for example, of how to create psychological safe spaces to empower teams, especially whenever relationship based. One of the high stressors as well they would mention, according to studies, would be relationships in work, also, or relationships at home, that causes a lot of stress. And all the more now with the series from the time that we're experiencing, from pandemic to the oil crisis, through very uncertain times, even the rise of the age of AI, the uncertainty, the volatility of everything. So definitely it has impacted severely on populations.
that rise in the age of
Mhm.
AI, what specific uncertainty are you capturing that's becoming a mental health issue?
Yeah, so many different facets. So we can start with school, the expectations for school, how AI impacts certain learnings. At the same time, job certainty. I think there's also a wave of layoffs occurring because companies would rather invest on AI rather than workers. But at the end of the day, that's livelihoods of people, and we're forced to upskill really quick, really fast. And if not, you're left behind. Causes a lot of uncertainty, anxiety, or let's say even if you would keep your job, a company would, okay, we need to do AI or else our competitors gonna overtake us. So there's a shift of everyone needs to upskill and learn. And when, let's say, the older, more seasoned generations, they would struggle also with having to upskill. So a lot of things affecting it. Those are just a few of the many aspects that AI affects mental health also.
It is, but as you're a tech-enabled mental health
Mhm.
company and social impact enterprise, what do you hope to bridge in that? You've mentioned the seasoned executive.
Mhm.
He's trying to get his or head around
Mhm.
AI and how it can impact the company more productively
Mhm.
versus his or her workers
Mhm.
on the far end.
Mhm.
How can Empath bridge that gap
Mhm.
and
Yeah.
solve both things? Keep the job or maybe even have a better job and
Mhm.
better quality of life.
Yes, definitely. For empath, I think it grounds back to the principle we have or our philosophy when it comes to technology. So for us, we wouldn't deploy technology for the sake of technology. We want to make sure it's intentional, it's human centered. At the same time, we also actively try to have it data driven, to measure impact. So for this one, that's our core philosophy. It's even my core philosophy as a software engineer or person in the tech space. Um, how empath can help bridge that is a lot of the pressure comes with adapting, being able to adapt, being able to transition throughout this change, and what happens to transitioning of these big changes in the world. You would really need to support them mentally. What skill sets, coping skill sets would they need, even from a simple as sleeping. How do you help develop their sleeping? How do you help support them when they have to learn things so fast? And that's something that empath would want to and are currently doing to actively help companies and even schools.
So when you hear the Pope Leo, come out with his first encyclical, and it had to be an AI, and he did make a mention that it was so important to keep things humanized and also leave people their dignity.
Yes.
How did that resonate with you? And did you have maybe a look back at how your principles at Empath aligned, or maybe needed more realignment to that encyclical?
Yes, completely agree with it. I think that even as a person in the AI expert tech space, I'm a very big advocate that it still needs to be human centered. I understand the dangers of misusing it or what it could be, especially with maybe even companies or other organizations that might not necessarily care, or that's not really their incentive of developing AI. Maybe for me, that's a very short sighted way of looking into things. But I think I would deeply resonate with what the Pope said. And I do agree with it. I think it's still a black box, a lot of uncertainty. That's why, for me, even as currently studying psychology, and also being in the AI space, I really want to actively research and do studies and making sure that how we use AI will not be extremely detrimental to us, or how do we avoid it? How do we address it? Make sure it doesn't impact our critical thinking, or it doesn't impact the way we socialize with people or support mental health, especially when 1 in 5 young people would use AI for mental health support. But if done and misused in that way, it can lead to people just being revalidated for unhealthy thinking mindsets, because part of therapy is correcting unhealthy thinking mindsets. But the general for the use of AI or generative AI is that it's incentivized to make you feel good. So they would agree with you with all these things, say nice things. So having to be able to even spread awareness of using it responsibly, and why even still a licensed therapist is important, is all the more important here for us in Empath.
What's the scariest thing you think in that black box with AI in the intersection between psychology and mental health?
I think it's really to over-validate unhealthy behaviors. One, there's a profit incentive for that, because it's also more money if you're addicted to it. And I hope that we are able to build technologies that are not necessarily that's their default for just over validating, because it has led to self harm for a lot of other people, or encouraging negative behaviors. At the same time, some also use it to misdiagnose themselves, so which can also be harmful. So AI said I have these things. For example, AI says I have ADHD, or AI says I'm like this, which people may attach that to as an identity, which is also concerning, because that would also over validate certain behaviors, and rather than healing and moving forward.
To what extent do you think we're in control of the prompts in what goes into the AI so that it does not over validate? Have you figured out maybe an empath? There's a way in to change the course of what you fear of over validation?
Yes, definitely. I think it's down to the system prompt also, and the guardrails. So system prompt and guardrails. So studying psychology, there are different frameworks for counseling, therapy, being able to train it properly. So ethical data, the quality of data that's given, at the same time, really the guardrails that are involved, down to privacy, down to what's the system, the master system prompt, and the training that it receives.
So in your 6 years, are you confident you have enough data to feed the prompt to make sure that you course correct the potential over validation?
For us, definitely there's still a long way to go, which was why we haven't completely, let's say, launch it. It's still for this particular product, so it's still undergoing the training, and then the quality of data, and then the safeguards. So we use AI right now very mindfully, but it's not a full-blown product necessarily that will open to the public just yet for now, because we still want to do that gradual development as well.
And what are you discovering in that early stage of deploying AI in that one
Ooh.
product in Empath?
Well, one, it's really down to the system prompt. As in, there's a lot of AI chats and support, but even studying particularly in psychology, it's very complex. There's a lot of frameworks, when to apply the frameworks, the theory of counseling. Sorry, I'm not sure if these are making sense, but a lot of people tend to simplify mental health chat product. There's a lot of ethical training that would require it. And I think certain use cases also. Right now, I think that's generally what I can say about it. But yeah, there's still definitely a long way to go. There's a lot of uncertainties, but at the end of the day, that's what we're also passionate about and what our mission we want to do in terms of keeping it human centered as well.
Are you finding that there's a need for policy? You mentioned guardrails.
Yes.
To what extent can local policy help? If it can, innovation often comes ahead of policy. When policy is there, it's already old or not so useful.
I think definitely there's a need for policy, for guidelines. Right now, companies can do it internally. There's something called AI governance. So, for example, which documents are you allowed to upload, if ever to have it processed? Like these are not allowed to be uploaded in ChatGPT for data protection, or the transparency that you need to do. Like say we're restricted to maybe email crafting, but when it comes to let's say processing certain data and giving analysis and feedback and commentary, it needs to be signed off and checked by someone. So these are guidelines that, let's say, if policy hasn't caught up with yet, definitely there are ways that internally schools and even companies can establish AI governance.
What about schools? It's very interesting that you've engaged them early on and they're your first stakeholders. What have you learned in that process, knowing that you started presumably with kids who were studying at home?
For us, it was...
Or was it hybrid? What was the setup before and how is it different now?
For us, our first one, I think what I can share is that it was a law school. So for those, it was, yes, over the pandemic. Definitely that it's really interesting how we live in a time that their formative years are at home in the pandemic. And that has severely impacted their development in mental health. So for example, there was one client that mentioned, even let's say grade 2, they don't know how to tie their shoes when they got back to school, or when they first went on site for example, colleges. They got so tired walking around, showing up in class before they would, after class, socialize with your blockmates and everything, but they just go back to their condo units and then rest or go home. So a lot of behaviors came about that definitely were impacted by the pandemic. And there's still a lot of work because it definitely impacted how people lived and also their mental health when they returned back on site for a lot of these things in school.
So now when Empath engages children in school, what is the approach and why? Maybe give us a case study of a success story of a community, as you are a community-based tech-enabled mental company.
Yeah. For us, other than it being on the platform, we also have something called psychosocial support training. So we've also did an EduDev Summit. So this is where we are able to talk about the mental health crisis in schools. So we are able to train around over 400 educators, guidance counselors, and also even some school owners as well.
You call it a crisis. I mean, we've only heard much about learning crisis, but is that in any way parallel to the mental health crisis you just mentioned?
There's a rampant rise of mental health concerns coming about. At the same time, self-harm, instances of self-harm among students more than ever. Students going absent, not completing requirements, having anxiety episodes in the middle of class or depressive episodes. So definitely there's a crisis going on. A lot of it is also impacted because they came from the pandemic as well. And for this one, we would establish, other than the tech platform, we also have trainings that's really great for education and awareness. So, psychosocial support training. It applies mental health first aid principles. So, for example, if a teacher, or sometimes even security guards in schools, um, what are the signs that they would spot that someone is showing signs and symptoms of maybe self harm or mental health concerns, and what do they keep in mind? How do they best support them and help them? I remember one time I experienced an episode in the middle of school when I was younger, but how they addressed it was they made me smell white flour. But it's like, okay, smell this, smell
Did
this.
that help?
And no, not really.
Okay.
It got me more anxious. But for that one, what now we train them is how do you talk to them? How do you make sure they're okay? That's not triggering for them. That's able to de-escalate the situation, because you never know. It could also save a life. So even let's say janitors or security guards would undergo this training, because usually they also are the frontliners for these things.
The teachers are frontliners as
Yes,
well,
yes.
even more so.
Yes, yes.
Is it a
Mhm.
challenge to unteach maybe some of the things they already know and come in and show them that there's another approach to the Gen Zs?
Actually, at least from our experience, not so. Mainly because they feel it. They says, yes, we need this. Yes, it's so, because it's so bad already. They recognize that we really need to be equipped. We really need to be educated, or really need to have resources. So I found schools very open, even more than companies actually, to integrate more mental health systems, because they really feel the impacts of it. And it's young lives we're also talking about.
And where did the parents come into the picture? How are they engaged? Is it through the teachers or through the students?
Yes, for that one, it's in collaboration with teachers and guidance counselors. I think parents can also be quite tricky because sometimes there is stigma, but we also host psychosocial support training for parents as well. So, what are the signs? How do you approach your teenage son or teenage daughter on mental health struggles, because it's sometimes difficult for them to open up about these things. Definitely, it's a bit trickier with parents. Some can be very supportive. Some, it would take them a while to be open about it, but that's also part of the fighting the stigma and being able to educate other people when it comes to mental health.
So when you convinced your parents that I'm going to go for it and build Empath, was that a difficult conversation with mom and dad?
No, they were very supportive about it. I think they know that it's definitely going to help families, because I think from my personal experience, it really impacted my family. My parents didn't know what to do. They would visit me in the ER when I was younger, and for them that was a very big wake up call. And they understand that there are other parents that silently go through this, and they had a difficult time of who do we talk to about this or that support group. Even my siblings, it impacts a lot of families, and they know that it's not just going to help or support the very person who's going through mental health struggles, but even the family that feels that impact as well. So I'm very grateful. They're very supportive about it. And I'm also grateful that they were very supportive about my mental health journey, because it would not be possible if they didn't support me throughout that healing process.
What would you tell parents right now struggling silently and quietly, knowing that there is a child or children in the family that are undergoing mental health issues, but they just couldn't open up?
I think first, one, don't feel guilty about it. I think a lot of parents feel that it's their fault, or they failed as a parent if their child is struggling through mental health concerns. I think that's what my parents also experienced. But in reality, with mental health, it's very multifaceted. There's some, let's say, conditions. You're also born, or it's inherited. So there's some conditions that it's really the chemistry makeup. It's hereditary. So it's something that's out of your control also. And I think for parents, there's a way also forward. So first, when you hear about it, don't feel that you failed as a parent. The fact that you're aware of it, and then the fact that you are open to actively work on it is already halfway through the battle. So I think first, forgive yourself or don't feel guilty. Don't shame yourself for it. Second, there is a scientific and evidence-based way to help support your child. So don't worry about it. Worry about it. Be concerned, but there is definitely hope. And we have, let's say, organizations or companies like Empath to be able to best support them through it.
And how exactly? I mean, I'm thinking now it's an online service. So do they all gather up in front of the Zoom call together with a counselor in front of them? How does it work?
Yes, so for us, there's one-on-one for our online platform, one-on-one with the child, and then also the counselor, the psychologist. Another one is we do have additional consults where it's just the parents, and then also the counselors, or sometimes if needed, there would also be the child as well. So depending on the situation, as much as possible, we understand the impact of community. Sometimes not just the parent, but also the teacher. We also get the teacher looped in to how to best support the child going through that.
Does it always have to be online? I mean, presumably you'd want something on site, face to face, as you'd know the little nuances that you wouldn't pick up if it were an online service.
Yes, we do on site as well. So with the companies and even the schools we work with, we do entertain. So we have a team that also comes by routinely for some of our organizations. So it's actually mixed. So it's either depending on the client. Also, we do offer on site. So we go to the school or we go to the company site, for example, or it's also hybrid for online, because at the same time, some employees or even families, due to traffic, commuting, or location, they would also appreciate also an online platform for it.
But connectivity is an issue. I mean, there are a lot of off-grid areas here, and if you mean to be inclusive, then you'd also want to reach them. So how then is that workaround?
Yes. So for those ones, we've had we also flew to certain sites, schools, and everything. So definitely we adjust. So there are some engagements and some clients that we really go on site there.
It must be difficult getting professionals, though, mental health professionals, as staff, to carry on with your work. I mean, how do you find them and how do you train them?
Oh, I think for us, for us, I think it's great that we establish our philosophy and ethos. So it's great that we're very strong on our values and principles. And then I think that also helps attract mental health professionals on board with us. At the same time, we also try to give them value for what they are, what they're looking for. So part of it is learning and training and development opportunities. Another one is also even the seamlessness of a system. So with our platform, it makes it a lot easier for them. What not many people know is that some mental health professionals, they don't like admin work. They prefer what we do with our system or with our platform. It eases off that the admin work, the operations that would take other than just being in the consultation. So their headspace, what they just need to do is just be there, be able to put their full attention on the client and not worry about the busyness of the background, which the platform can seamlessly work on and also the team can work on for them.
So it's not difficult to hire. You're getting a lot of applications. It's not like you're having to chase them. They're queuing up.
We do have a strong. For us, it wasn't so much big of a struggle actually. But we make sure that they're vetted, so we keep a tight knit team. But so far, we've had a lot of them. Let's say for 5 years with us. Actually, ever since we started.
Are you not finding it difficult to secure the professionals, the mental health professionals, in a country where they're not really that forthcoming?
For us, for me in particular, at least from Empath, not as much, to be honest. We do have a roster of mental health professionals, but I understand there are corporations and schools that struggle with it, especially when the healthy rate of ratio for other countries for mental health professionals or psychologists is one psychologist to 5,000 people. For the Philippines, I believe it's one psychologist to around 125,000 people. So that's a drastic difference. And there are far-flung areas or provincial areas, or not, or even not totally provincial areas that don't even have an acting psychologist. So sometimes they would need to fly in someone. That's why what was helpful for our platform, which has different languages also, from Tagalog to Cebuano, to really have it more accessible for those, let's say, in areas where there's barely any psychologist or even guidance counselor there. For example, also for guidance counselor, there's around 2,000 guidance counselors here in the Philippines, and for 28 million students. So that's 1:14,000. I think the impact of struggling to find mental health professionals comes from corporations and schools. So that's why for Empath, we have a roster or a pool for them to just tap into, that would make it more accessible for them. So for us, I think why we've had psychologists with us for years, since we started, mainly because one, we also invest in their learning and development. Two, we handle a lot of the admin operations in the backend for them so they can focus more on their clients. Three, I think even income, very seamless the income because it's all consolidated in one platform. They're easily able to get consistent clients for our setup. I think a few of them mentioned what they like about Empath because of our system setup and our B2B, our organization partnerships. They have relatively more returning clients in Empath that are sticky, or it's easy for them to come back compared to other institutions that they work with, for example.
Secondary trauma, compassion fatigue, these are issues faced by frontliners. How do you deal with that then, considering the statistics you just mentioned? They do get the job, but they're also faced with the multiple clients that they have to face. And maybe wouldn't even suffice because it's just too much.
Yeah, definitely compassion fatigue is something that is experienced for the healthcare profession. So how we go about it, even for the culture of Empath, not just the psychologist, but also the team, we have certain systems that would definitely encourage them to be able to take care of their well-being. So, for example, the really more straightforward one is the mental health days. So even as not just them alone making sure their mental health is healthy and good, but we make sure our leaders or those leading the team are able to spot and be able to be mindful about each people's mental health. And the way we go about things is also, for example, what's their workload, checking in on them, being able to do certain activities that would help nourish them. So actually for Christmas, we had a spa day in Empath. So instead of a Christmas party, we checked in what the team wanted to do. So we had a spa day for Christmas, for a Christmas party. So it's really
I would have thought
listening to
food.
Huh?
They wanted spa. Spa treatments.
There was a buffet in the spa also. So it came along with buffet. So for us, being able to take care of them, debriefing sessions are also important. So sometimes we have our psychologists would debrief each other as well, our professionals, because even they would need support. So it's really creating that system in Empath on how to debrief, decompress, whether it's through leadership and training with the because we also apply our own psychosocial support skills, and also the types of activities that we listen to into what they need.
How does that system work in a corporate setting, considering there are corporations that are still thinking of mental health perhaps as an expense rather than as an investment?
For us, for mental health, or at least what we also share, right now, there's also a mental health law. So that was signed in 2018, which mandates schools, workplaces, and LGUs, local government units, to have integrated mental health services and also mental health support.
How has that worked out for you, given that it Empath was created 2 years
Mhm.
after that law.
Yeah, I think it also attributed to the amount of clients we were also able to get. So on the bare minimum level would be compliance, for example, for corporations. Bare minimum, but we definitely would love clients. We love to go beyond that as well. So that's one. The second one is it would really help in terms of absenteeism or presenteeism. So being able to have their workforce more engaged to better support them so they're able to perform better. And then third's also the risks. So let's say, for example, safety risks. In the office, if something happens, what are the safety protocols to do? So there, I hope to also bring the misconception that mental health isn't just a nice to have, but it's very important and very beneficial for a company to be able to invest on mental health, because the people taking care of the well-being of the people are also important. At the same time, not just compliance but also safety risk concerns.
You mentioned about productivity. I wanted
Mhm.
to ask about what's something that looks like laziness,
Ooh,
but is actually a mental health struggle.
interesting. I think one, maybe not being able to show up for work. Um, there are definitely it's a case to case scenario, but a lot of it of an indicator is if they aren't as present or they can't show up to work. It's also a very big indicator that something they're going through something. So it's great to check in on them. How you can check in on them would be, oh, I've noticed that so and so and so is. I just wanted to check in how you're doing, and I think that's one symptom or sign corporate leaders can look into, and that's also how they can just open up that conversation to check in on them and see how maybe the company or they themselves would be able to support them well.
Are there any metrics at this stage of Empath that you can show any corporate leader that it is worth an investment because it shows up in your bottom line?
Ooh, that one's a bit, admittedly, so quite tricky because it depends on a case to case basis.
The mental health law that you mentioned, it's been there for like 8 years.
Mhm.
And the implementing rules, is that law working out, or does it need to be
Mhm.
amended given that
Mhm.
we've gone through a whole pandemic that probably upended most things about mental health?
Mm. For us, I think it's definitely relevant. In fact, I think around 2024, recently there was also another law signed. Sorry, in 2024. In 2024, there was another initiative that was also signed in terms of more integration for education in schools for mental health. Definitely, it's still very relevant. At the same time, there's still a lot to do to make sure it's best implemented. That's why I think Empath also started. Empath started to even help out these implementations. So, in order to implement the mental health support for schools, even corporations, and hopefully in the future down the line, local government units.
Beyond the NDAs, there should be perhaps some
Mhm.
metrics that you go by that would
Mhm.
define why it's good to have a mental health
Mhm.
program within a
Mhm.
corporation.
I think there are so many aspects that we were able to bring. So one was to increase the or improve the retention rate for our clients. So keeping the best people still engaged. So for Empath, a big part of us is being data driven. So with being data driven, you're able to objectively establish or identify what's the mental health scope or scale. So that's actually quantitative on how we go about it. Um, and with that, we're able to identify okay, these are the at risk people, these are those that are thriving. How do we bring that at risk people to a more thriving state? And then so that we use that informed for informed decision making to be able to establish more effective programs, even from down to the topics. If you know a certain demographic of people, let's say mothers, the demographic of mothers are those that are in high stress. So, what are supportive benefits or support initiatives we can do for the mothers to be able to help improve their well being? So, that's one. So, with retention, helping retention. Two, even conflict management. So, maybe there's tension in the office. How do we help address conflict management there? Third would also be leaders. So, being able to help them train about psychological safety, even generational gaps, how to bridge generational gaps to improve work dynamics. So those were some of the few cases that we were able to help support our clients in.
We got about 5 minutes. And for those listening and watching, wondering what it's like to be a Gen Z tech enabled leader like yourself, what would you think are the habits that founders need to cultivate? That's not so out there, but it's something that a young person should have.
I think for me, it's continue to be hopeful. In a time that is very uncertain and very difficult and volatile, I think for me, even from my own personal journey, it was continuing to have hope. So for me, hope could be a blazing fire, or hope can be just a small candle that's a small candle that's lit in a dark room. But I think what's important is throughout difficult times, even in your own mental health journey, not just being a startup founder, continue to have that burning light, because you never know also what it will bring you in terms of healing, and it will also help light the way for others. So I think being for Gen Z, we're born or thrown into a time that's very difficult, and I understand, and it's very uncertain and anxiety inducing. But I think at the end of the day, hope is a very powerful thing throughout this time. So for me, might be sound a bit cheesy, but it really helped power me through everything that I've had to go through. So, and I really encourage my generation to do the same.
If you could ban one toxic belief of your generation, the Gen Zs, about mental health, what would it be?
I think it's to make your mental health struggle your identity. So meaning that if you're going through maybe certain mental health struggles and conditions, it doesn't define who you are and who you will be for the rest of your life. There is definitely ways, treatments, support, types of support that can definitely bring you to the best version of yourself. And similar to what we say in Empath, and we're here in Empath to help journey with you to that better well-being.
How did you power yourself out of it?
For me, it was really hope. I think it was also the realization that when I give up, or the sooner I give up, it automatically means failure already. In the sense that you just guaranteed the closed door to not being able to achieve that healing. So for some days, although I do feel more tired than other days, I think it was really hope. That was one. Two, it was definitely the support of my therapist, psychologist, family members. Let's say if maybe there's others that would have family members that are not as supportive. You can have your chosen family members, your chosen family. So those that might not be blood related to you, but who are family in that sense of that relationship and the dynamic. And for me, I think I really attribute to continuing to have hope despite the difficulty, at the same time getting the proper and right mental health support.
A final point, how do you keep mentally healthy?
Ooh.
Given all the challenges you now face and have taken on as Empath founder.
For me, on a practical level, I make sure to block in my Google Calendar 1 or 2 mental health activities a day. So
Such as,
well, one will be exercising or working out. Another one is, it could be as simple as playing cards with my sisters, or maybe even playing with my dogs, for example. So take note, when it comes to self-care, it doesn't have to be a full-on vacation that's very expensive, but it could be through the little ways that are not expensive, that are easy to access. At the same time, nourishing for you. So it could be as simple as 5 minutes or maybe even 1 hour. So for me, I make sure to put that in my Google Calendar to block it out one way or another every day. Because just like how you need to nourish your body with food, physically and everything, you also need to nourish yourself mentally.
Well, all the best in the next couple of years on your journey,
Okay.
continuing journey for Empath.
Okay.
Thank you, Steph.
Thank you so
Appreciate it.
much.
Steph Naval of Empath. We'll catch us again next Thursday, 9 p.m. Philippine Standard Time on One News. You can also check out the long conversation on YouTube, Spotify, Apple Podcasts, and Google Podcasts. If you haven't done so, like or follow my social media pages. I'm Cathy Yang. This is Thought Leaders.